It is my pleasure to attend the official launch of the D8 Health and Social Protection Program Office in Abuja. On this special occasion, may I, on behalf of the government and the good people of Nigeria, congratulate member states for this great milestone, which is capable of promoting human development and to also enhance the well-being of our citizens. In the same vein, I wish to commend Dr. Ado Muhammad for his zeal and enthusiasm put into the realization of one of the very important missions of this noble organization. Earlier this year, the Country Partnership Agreement establishing the Health and Social Protection Program Office in Nigeria was signed between Nigeria and the D8 General Secretariat. The exercise was a significant step in ensuring that members achieve improved healthcare systems. And as part of our obligations, we pledged our unwavering commitment to the successful implementation of this initiative. I am therefore convinced that the commissioning of this office this morning would help drive our shared aspirations towards achieving affordable healthcare costs, inclusive social protection program, and reformation of our healthcare systems. Distinguished ladies and gentlemen, the event of today is historic and timely in view of recent global health challenges and unprecedented pressure on our health and humanitarian sectors. Undoubtedly, the outbreak of COVID-19 pandemic is a stark reminder of the need for nations to build and maintain sustainable health systems. It is as well a call for us to commit to the realization of health-related sustainable development goals. I am therefore delighted that the D8 established this office to respond more quickly and effectively to health and social emergencies as the one currently ravaging the world. I wish to acknowledge that since the outbreak of the pandemic, the office, in other words this office, in collaboration with the D8 Secretariat, organized a virtual roundtable meeting of member states and established 2 working groups to facilitate modalities to cushion the socio-economic impact of the pandemic on member states. This initiative is commendable and demonstrates the preparedness of the D8 Office of Health and Social Protection Office to assist in the mitigation of socio-medical challenges. There is no gainsaying the fact that the task ahead of us is daunting and requires concerted efforts of member states and relevant stakeholders. In order to achieve the core objectives of the program and ensure its success, I wish to solicit the political will of member states towards the realization of this initiative through prompt funding and technical cooperation. The long-term willingness of our respective governments to support the office will play a pivotal role in strengthening the primary healthcare system the countries covered by the D8 office commissioned today. It is my hope that we will continue to share experiences and transfer knowledge in a bid to have a healthy population that will not only promote economic development, but also reduce poverty. On a final note, and on behalf of the government and the good people of Nigeria, I wish to reiterate our commitment to the success of this initiative and ensure the D8 of the readiness of Nigeria to collaborate with other state parties and relevant stakeholders.
I heartily congratulate for commissioning or opening of the D8 Health and Social Protection Program Office in Abuja. As Honorable State Minister has correctly pointed out, it's a historic moment, and I take this opportunity to warmly congratulate the great host country, the federal government of Nigeria, for donating such a beautiful complex, a beautiful office to function as the office of the program. Your Excellencies and the ladies and gentlemen, due to the surge of COVID-19, we are passing through a very difficult time, and I think the commissioning of this office is very important, that we take a fresh look on the health issues, because we are fighting together. As the High Commissioner of Bangladesh, which is going to host next year's summit, hopefully next year, because due to surge of COVID, it could not be held last year. I hope that all heads of government, heads of the D8 member countries will join the next summit. I want to stop here. Once again, I congratulate the great host country and the program and D8 member countries for this great occasion.
The overall vision of the D8 Health and Social Protection Program is to support member countries towards accelerating Sustainable Development Goal 1, 2, and 3. That speaks to poverty, that speaks to hunger, and then speaks to well-being. But in specific times, what do we intend to achieve? We will be supporting member countries through innovative sustainable financing, through resource mobilization. We know that the funding from government will not be enough to address health system needs. So as an organization, we intend to support all our member states in terms of resource mobilization to bridge the gap that will take member countries on the journey towards universal health coverage. That is one. Secondly, we also want to support our member countries in terms of health rates. We want to encourage and boost health rates within the member states. The 8 countries has a combined economy of $4.5 trillion, 1.1 billion people, but the trade between the member countries just translates to about $100 billion, which is grossly inadequate. So we want to ensure that we boost that trade within member countries to the tune of about 10% annually for the next 5 years, so that we can be able to get a huge chunk from the $4.5 trillion economy to boost the economy and then create jobs and then create employment within member states, and then also be able to boost the economy of our member states. So by and large, that is what we intend to do. In terms of boosting the health rates between. So we are looking at working towards pharmaceutical, biological, ICT. So those are things that will be working within our member states to boost the economy. Nigeria is the host country for the Secretariat, but this is not a Nigerian program. It's a D8 program owned by all the member states. But we are happy and pleased that the federal government of Nigeria, under the able leadership of President Muhammadu Buhari, has deemed it fit and necessary to provide us with an edifice, and also discharge their own obligation in terms of their counterpart contribution to the program. So we see this as a key step towards kick-starting the program. And we believe that as we commence operation, we'll be supporting member states through resource mobilization. We'll be supporting member states through use of evidence, of data for performance and impact, and then results. We'll also be supporting member states through innovative financing and then health rates.